morning and welcome back to 90 Seconds Healthcare. Our goal is really health literacy, making healthcare a lot more prevention rather than sick care, making healthcare a lot more proactive, engaging persons, community, and patients in their care. One of the things that I face at all time, and this is Dr. Ellahham from 90 Seconds Healthcare, is that I feel that even my colleague physicians and patients need some way of summarizing how can we talk about cardiovascular prevention or even cardiovascular care when the patient actually has heart disease. One of the things that you can find that may be significantly useful is first to start with the concept that really to be a superior doctor and a superior patient, we need to prevent the disease. Mediocre doctors treat the disease before it's evident, and inferior ones treat the full-blown disease. So like all of you, my colleagues, physicians, patients, persons, we would like to be superior patients, superior persons, and superior physicians. And even if the person has the disease, we can prevent the recurrence of the disease or the worsening of the disease. One way to do so is to think about A, B, C, D, E, F, and S. A starts with awareness. This is the health literacy. There is so much misinformation on social media. Sometimes even misinformation in the literature itself, in the medical literature. Awareness is, I want to know my numbers. I want to know my blood pressure. I want to know my cholesterol. I want to know that I'm not smoking anymore. I want to know my hemoglobin A1C, if I'm diabetic or not diabetic. I want to know my weight. I want to know how much I exercise. Knowing oneself, being mindful, being aware, being involved, have such positive attitude towards preventing heart disease. And even if I have heart disease, I'm going to take care of it. I'm going to control it. I'm going to be involved. Antiplatelet therapy includes especially the aspirin. So these are the platelet medication that minimize their effect, and we call them antiplatelet therapy. And there are many more. I'm not going to go over them, such as clopidogrel and others. Anticoagulation, things that thin the blood and make it less sticky. And these can be anywhere from the warfarin to the new, we call it NOACs, novel oral anticoagulants. These are, indications when patients have atrial fibrillation, if they have artificial mechanical valve, and the like. ACE inhibitor is a class of drugs for hypertension, high blood pressure, and heart failure, among others. And ARB is the same for hypertension and heart failure. So not all of the A's could apply. So for some patients, A is awareness, that's it. Maybe in others, it's awareness plus, say, the aspirin. For others, maybe awareness plus aspirin plus something else. It all depends on the actual patient and the condition. Again, this is a mnemonic to make it easier to understand these things. B is blood pressure. Blood pressure is so important. Systemic hypertension, as I've shown in other videos, is #1 killer globally. This is from WHO, this is from Professor Gonzalez, and from many other studies. So blood pressure, I need to know my blood pressure. Typical blood pressure should be no more than 140/90, but it's better if it's less than 130/80 if possible. Beta blocker, this is a class of drug that ends with olol, so bisoprolol, atenolol, metoprolol are examples of this class of drug. It lowers heart rate. We give them to patients who have hypertension, although they are not first class or second class antihypertensive agents. We give them for patients who have heart disease, patients post-heart attack, even patients with palpitation, and maybe atrial fibrillation. Again, these may apply or may not apply. The blood pressure applies at all times. I want to make sure I have a normal blood pressure or a controlled blood pressure. The beta blocker, once indicated, we use them. C, cholesterol. Again, cholesterol may have 5 blood tests or 7 or more. But the most important and easiest to remember is the LDL. Again, I have a video on cholesterol. Please go to 90 Seconds Healthcare on YouTube. Join us, subscribe, hit the like button if you like it, and follow us, please. If you find this helpful, and share. Our goal is nothing but the benefit of the global community to prevent or control heart disease and be healthier and better. And also we have things on quality, on improvement, artificial intelligence, and digital health. So again, the LDL needs to be controlled and low. It depends. If a person has no heart disease, then we accept an LDL of 116 milligram per deciliter or 3 millimole per liter. If they have established heart disease, we will not accept it till it's less than 1.4 millimole per liter or less than 50 milligram per deciliter. And these, you can go back to my video to review. Cigarette smoking, all sorts of smoking, all sorts, are harmful, causing not only heart disease, not only worsening heart disease, but causing, tumors, causing lung disease, and many, many other things. All forms of smoking include water pipe, we call it argila, a midwach, which is used in some countries, pipe, cigars, and definitely, unquestionably, electronic cigarettes. D is diabetes. And, we know that diabetes is something very prevalent. Even being pre-diabetic is something I want to keep an eye on. And again, one way to diagnose it is the fasting glucose, but also the hemoglobin A1C, which is very helpful. And this is something I need to know. So all of us need to know our hemoglobin A1C. Diet, what to avoid. I have a whole program, and I put on 90 Seconds Healthcare how important it is to minimize our sugar intake, among others, and our fat intake, and to eat plenty of vegetables and fruits. And if I want to eat meat, it's fine, but I can eat fish and also eat red meat, but less so. And then very importantly, weight. Again, we are all beautiful and we are all looking great. It's not about the beauty at all. It's about the health. So the American Diabetes Association talks about weight loss as having a very reasonable goal, such as, for example, loss of 5% of current body weight, and definitely no more than 10%, but sustain it. If we sustain that weight loss, there are huge health benefits. Exercise. Again, it's not about making things difficult. It depends. Does the person has arthritis? Does the person has other problems? But in general, it's around 150 minutes of exercise, including walking, and if possible, brisk walking, 150 minutes per week. 150 minutes per week. So if you do the math, it's around 30 minutes daily. Then I have a whole video, if you like, you can look it up on 90 Seconds Healthcare YouTube, discussing what type of exercise in details. And then healthy food, not only we want to diet and not eat some form of food, but there is food that we need to eat. So you probably know berries are very helpful for the heart. I have a suggestion that maybe you want to eat a plate that has 5 colors, like have the dish have red for tomato, green for lettuce or cucumber, yellow for lemon, etc. And, make sure you don't have unhealthy food at home. Once you get it home, then we're going to get in trouble. So again, I will avoid drinking sodas, and I will drink water, and occasionally I will drink fresh orange juice or other fresh drinks. I will also avoid, excessive caffeine. And if I want to drink anything, I will drink perhaps green tea with a little bit of honey instead of the many coffee drinks that we have. Chips should not exist, right? Avoiding chips. If you want to make the chips, you can make it at home by boiling the potatoes and then cutting them, putting them in the fur, and hopefully you can make your own chips, which is a lot healthier, etc. And then stress management. There are so many ways to address stress. There is a whole science of cognitive behavioral therapy to deal with things in a rational, objective, smart way, in a positive way. But we don't need to make things complicated. Feeling blessed, understanding that things that are happening are acceptable. Do muscle relaxation, which anyone can do. Taking deep, reasonable breath. If you overdo it, you can feel dizzy. It should be deep, slow breath. And then walking or relaxing or listening to what you feel is good and positive is all good. So as you can see, although this ABCDFS looks very simple, it's quite practical to help us prevent heart disease, help us prevent the recurrence of heart disease, help us control heart disease, and help us be healthy, not only related to heart. You could argue it has benefits on the kidneys and other organs. With you, Samer Ellahham from 90 Seconds Healthcare. Please stay happy, stay safe, and stay healthy. Thank you.